We're waiting to go to YouTube. All right, I believe we are live. Good morning, everyone. It's January 24th, 2023. It is 8:02 a.m. I'm Deanna Diamore, the Director of Health for the City of Norwalk, and I'm calling this the January 2023 Board of Health meeting to order. We have here present for the meeting, Board of Health members Ken Laleen, Janet Karpiak, Norman Weinberger, and Terry Quell. And we have staff members Brian Weeks, Carla Rodriguez Alicia, and Aniela Fignon, and Bill Mooney as well. Good morning, everyone. Okay, so we have our first item on the agenda is the approval of the November 22nd, 2022 meeting minutes. Do I have a motion?
So moved.
Terry moves. Do I have a second?
Second.
Second by Ken. Are there any comments, edits about the minutes? All right, seeing none, all those in favor, say aye.
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 Minutes pass unanimously. Just a few updates before, for me, for the director's report, before we get into the bulk of the meeting. Wanted to share, everyone, we're making some headway with staff. We have some staffing updates. Really excited to announce that Corey Tobias, who is a former public health nurse at the health department, she's coming back. She's coming back to our team. She was instrumental during the COVID response, helping to assist with the clinic. She also really held a big leadership role when we put out the homebound vaccination program. She's bilingual, English, Spanish. So really excited to be welcoming her back next month to our team. And we're also in the process of hiring an additional advanced practice provider. That's a position where we either have, a physician's assistant or an APRN. And so we're going through that process now. So hopefully we'll get somebody on soon. We're also going to be hiring somebody who's going to be starting next month as well to assist Carla as a health operations assistant, working really closely with her. We're utilizing COVID-19 funding to help provide additional support. We have a lot of different funding streams specific to COVID that are going to be continuing, and some that we've gotten extensions for. So she'll be really helpful with the financials, and it will be a great team member to Carla. And then we're also in the process of hiring the receptionist position. Catalina Mosquera is now going to be in the public health program associate position, and so that position is going to be vacant. And so we've got a lot of applicants for that, and so Carla is going through all of those right now, and hopefully be able to set up some interviews soon. And so those are some of the updates with the staffing. For the minutes, it's 8:05, and Darlene Hoffler, staff member at Health Department, has just joined us. Good morning, Darlene. Good morning.
Morning.
Additional updates, we're still plugging along with the strategic plan. We should have those work plans for you shortly. I'm sorry it's been taking a little longer, but we should be getting that to you shortly for review. We also are working on updating the bios on the website. So Aniela, I believe, emailed you all. So if you could get us updated bios, that would be great, so we can make sure we have that up to date on the website. And I believe that's all for the director's report. Any questions?
It's Terry. I don't have a question, but I just want to say, I think it's wonderful to see that so many of the employees that we have are kind of able to move up the ladder into, more challenging positions. And I think that's terrific.
Thank you, Terry. That's yeah, it is great to see that. And that's something that I think has always been part of the culture here, right? With Tim for sure. And I'm sure for other directors before him too. So that's something we definitely want to continue is that. And I know that's something that we've always encouraged that with us. The board has always talked about succession planning. And so we take that to heart, and we're excited we're able to continue to offer that growth within our staff.
I think workforce retention is such a big issue. It costs so much to train an employee, and having low turnover rates is critical, and that you have to have a pathway to get those, because you can't just, make that up as you go.
Mhm.
So I think it's great to be able to maintain that type of large enough employee base that is here, and you can look at the years of service. That's a big deal. It works very well.
Yeah,
So applaud the efforts.
thank you. All right, I'm gonna turn it over to Brian Weeks, our Program Director of Epidemiology and Informatics, to give us some updates on where we are with surveillance, a lot going on during this respiratory season.
All right, thanks, Deanna. Good morning, everybody. Let's jump right into it. So I'm going to share a screen and we'll kind of do the traditional presentation. I'll try to make it comprehensive, but at the same time, quick. So bear with. So what should be showing up on your screen, firstly, is obviously the City of Norwalk COVID-19 Data Hub. We'll jump right down to the CDC community levels. So let me just move the Zoom bar out of the way because it's blocking my view. All right, so as we kind of remember, the CDC COVID-19 community levels is a 3-tiered system. That's low, medium, and high. So low in green, medium yellow, high in orange. And again, it's factoring in severity of illness, especially on the burden on the healthcare system. So just keep in mind those metrics. So again, it starts off with using the case rate for the county for the last 7 days, and then further factors in the staffed patient and inpatient beds with COVID patients, and then also new hospital admissions for COVID-19. Again, both of those metrics for the last 7 days as well. And so with the update that happens every Thursday from the CDC, Fairfield County is at the medium level. Again, a reminder what that entails. And I'll jump just to this screen just as a little bit easier to kind of view it. But as you can see, those at high risk of getting sick should be wearing a mask or respirator. If you have household social contact with somebody high risk of getting sick, consider self-testing to detect infection, consider wearing a high quality mask when indoors with them, stay up to date with COVID-19 vaccines, including the recommended booster doses, maintaining ventilation improvements, avoid contact with people with suspected or confirmed COVID-19, follow recommendations for isolation if you have suspected or confirmed COVID-19, and follow the recommendations of what you do when you're exposed to someone. And again, I'll go into a little bit more detail about this a little bit later, but just keep in mind that also, given that, we're still experiencing higher COVID activity, wearing a mask or respirator right now is not a bad idea. And so let's jump right into it. So again, these are the links for COVID testing, local links for COVID testing vaccine and the COVID info center for the city. But we'll skip the case rates and the percent positive for now, just because, again, there's a lot of gray areas, as I mentioned in the past, with at-home testing being kind of the majority of testing for COVID. And so therefore it's creating kind of a knowledge gap because that information is not reported. So therefore, let's go to the items that do demonstrate severity of illness and are much more reliable measures for what's going on with the current pandemic. So as you can see, what is showing is the state of Connecticut COVID-19 hospitalized patient census by county. And again, this is for the entirety of the pandemic. And so you can see the most recent data that's depicted here. It takes a little while sometimes for the state to update this in the Connecticut Hospital Association. But this is showing data up to January 21st. The point that I want to emphasize here is because if you turn your view to the right-hand side of the chart, you can see here that, we had a peak of 779 so far, and that was in early January. So that was around January 7th. But you can see it's been a continual decline, even up to the most recent data points. So we're at 556 currently for the state. Again, we had a peak of 779. Basically, this is about 2 weeks, 14 days of data plus that's demonstrating this downtick. So it is suggesting that we peaked in the early part of this month. So that's actually really, really great news. Again, it doesn't suggest it's the only peak we have. So it is something we got to keep in mind and be careful with. And, we're not out of the woods yet because it's still, decently high activity for COVID that we are experiencing for the state, as well as for all counties. But fortunately, Fairfield County is at least at third place in regards to the volume of these COVID-associated hospitalizations at 130 versus, say, the highest, which is New Haven County at 182. But, again, giving some perspective, you look at around the same time of this year, where we were, just the previous year in January, 2022, you can see we're almost more than 1,000 less COVID-associated hospitalizations. And then if you look at, the year before that, 2021, just even lower as well. So fortunately, and also like with the beginning of the pandemic, because obviously we don't have January data because, testing and everything didn't start rolling out until March, April, much substantially lower as well as compared to 2020, the start of the pandemic. So really, it's suggestive of quite a few things kind of going on here. Again, one, I think the milder winter is a player in this. I think also the other really important thing to emphasize, if you look here, a little bit of difference in terms of the annual presentation of COVID. You can see how we've been dealing with the Omicron variant for, more than a year, right? It started actually in late 2021. And that's what the Omicron variant caused that major increase because it was very novel at the time. Now we have various mutations and new iterations of it or some variants. Most recent one being XBB.1.5. But again, they're still all part of that same family, so to speak. And so you can see how we've been dealing with Omicron for quite some time, and it's conferred immunity. So even looking at from the summer and fall time and up to this winter time, we've been having a pretty decent volume of COVID activity relative to these hospitalizations, as well as obviously COVID case activity in general. So suggesting that a lot of natural immunity has already occurred and relatively recently, along with those staying up to date with the vaccine. So when you factor all that in, along with the mild winter, it does explain why we peaked earlier. And then also we had the additional kind of early warning with the triple demic with influenza and RSV that also I think put people on a little bit more alert as well. So mixing all that together, I think it was, the factors at least contributed to things presenting earlier and not as severely as we initially were concerned about. But still, like I said, we're not out of the woods yet, so we want to really keep that in mind. And so again, staying up to date with vaccines is important. Again, the point to hit home here is that relative to as we kind of scale down in terms of age group, obviously there's more opportunity for those to become not only fully vaccinated, but especially up to date with their vaccine doses, which is those booster doses and additional doses. So the other obviously really helpful metric is again the wastewater surveillance, and so this is for Fairfield County, and you can see the Omicron, very introduction, especially in late 2021, early 2022, that huge peak there. But then also where we're at, where we did have a peak, but, again, supporting that downtrend as well. So the data is in agreement with that. So overall, a good thing, but again, not out of the woods. And so just looking at it from the variant and subvariant perspective, you can see here, again, what we've been dealing with, since, the pandemic in general and the data collection that the CDC has conducted. So you can see how BA.5, very much in the largest proportion of activity, of incidence and prevalence for COVID-19 in the United States back in October. You can see how it slowly decreased, and then BQ.1.1 and BQ.1 both entered the picture relatively at the same time, and you can see they've really kind of outcompeted BA.5, which we already knew at that time was highly infectious and also slightly more invasive of certain vaccines. But obviously, we had a new formulation, that was tailored for BA.4, BA.5. But then, unfortunately, obviously, we had other things that entered the picture too, along with BQ.1.1 and BQ.1. We also had BF.7 that was slowly entering the picture, and that was kind of what was driving the pandemic surge in China as of late. But then also we got XBB.1.5, and XBB grew very quickly as well, and now it is the largest proportion of all the variants and subvariants at 49.1% with the most recent update from the CDC. Now, looking at it from a regional perspective, again, regions 1 and 2 are the best indicators for Connecticut just because of our proximity to region 2, but also being part of New England, which is region 1. But you can see, again, it's all supporting the same pattern that XBB.1.5 is the majority for the Northeast, especially the Eastern Seaboard, but for the Northeast, more than 3/4. And it's very interesting. So again, it's XBB.1.5 is slowly growing around the nation. So what it is suggesting here is, unfortunately, since we're usually ground zero, we get hit first and very quickly, and very acutely. But as you can see, it's going to make its way across the rest of the South, the Midwest, and the West Coast. So they have yet to really experience their XBB.1.5 switchover, so to speak. So they have to be prepared as well, just because, as we know, COVID operates in kind of waves throughout the nation, and we're also a big nation too. And so with that, switching gears a little bit into influenza, you can see again, just as a reminder, kind of where we're at with this season. 2022 to 23 is the black line, so that's our current flu season compared to the other previous 3. This is looking at for emergency department visits for influenza-like illness. You can see how we peaked very early as well for influenza, and it's been a gradual decrease compared especially to other prior flu seasons. But again, you'll see here with flu, if you kind of look, you can kind of see, almost subtly in many cases, but 2 peaks here. So we're still not out of the woods, definitely with influenza. That's safe to say. It usually has the pattern of having type A influenza present firstly, and then type B influenza entering the picture at some point during the season. And as we know, we're not out of the winter yet, and anything's possible. We even have a forecast for wind gusts for today, so as a heads up as well. But nonetheless, we still have to keep an eye out for that, and so that there's also potential for it to kind of play into the picture. Keeping in mind, again, this winter season has been mild though, and influenza has been demonstrated with even stronger correlation to the climate and weather activity. So obviously, if things are going to stay warmer and more humid, there's less opportunity for transmission of flu. That's definitely demonstrated, and that's why flu always usually experiences its peak in true season during the winter time. Nonetheless, again, not out of the woods, and like I said, Type B is likely going to be jumping into the picture. But nonetheless, looking at kind of where things are at right now for the current season, you can see how it demonstrates that peak as well. For influenza cases for the state of Connecticut, you can see for Fairfield County, for influenza cases, for the case rate, you can see Fairfield County was the highest, then followed by New London County, Wyndham County, but then and also closely followed by the remaining counties as well. Looking at for hospitalizations for influenza, you can kind of see. Again, that's type A that's been running the show, a shade of blue here. Not as many specimens are obviously subtypes, so it's hard to tell what it is. But, again, given the proportion that have been subtyped, you could tell how the majority of those have been H3N2, which is, again, is usually known as the hospitalizer. Not so much type B at the moment, but, it's something we got to keep a close eye on. And then also in terms of, just patients that have been hospitalized, just looking at the age groupings, it is presenting in the typical fashion for H3N2, which is usually 50 years of age or plus being the largest majority of those that get hospitalized, as well as less than 10 years of age. So it kind of covers, both ends of the spectrum in terms of age groupings, the young, the really young, and then also the more elderly individuals. And middle age. So it's just something to kind of keep in mind. And then again, we also have experienced deaths related to influenza, so it's something not to overlook. And so you can see how it's been kind of jumping around a little bit. Still, type A being the mediator of that. Skewed more towards older age groups, which is usually typically what you want to see in terms of presentation for this, although obviously you don't want any influenza deaths. And we did have one pediatric death, and so it's totally for the current season, 57 influenza related deaths for the state of Connecticut for this current season. This is the map for the nation, updated from the CDC. And again, this is up to January 14th. But what's good to see about this, not as much red, orange, or purple as it used to be. You still see New York City is still a pretty hotbed for a influenza activity. DC, so these larger, more dense and packed cities are still kind of hotspots for that. But you can see how the Northeast and Eastern Seaboard is doing a lot better than it was doing before, even just compared to the prior week of the surveillance from the state as well as from the CDC. So, but you can see how there's still that high or very high activity, in that southwest portion or the western portion of the country. But also you got like parts of the south and southeast that's still also presenting in that cusp of moderate and high activity. So still, like I said, we're not out of the woods yet with that. For RSV, at least, it's a very solid pattern here in terms of this is the state of Connecticut for detections on the right-hand side here. You can see, again, we peaked a very novel and historic high for RSV, given this very unique season, but it's been a consistent downtrend, and it's basically at normal levels or expected levels in this current point of the season. And so that's really great news, mirroring exactly what's going on nationally, as you can see here on the right-hand side. Same thing with the peak, the downtrend, and decrease in activity. So again, great that the data is all in support of that. Great that we're following national patterns and things are kind of back to normal for RSV, but still something we got to keep an eye on as well. And get through this winter season because it could get much colder just even moving forward. So we just need to be mindful of that because I think there's also anticipated snow here and there. So something else to keep in mind. So with that said, prevention is still very much the name of the game. It applies to all these respiratory illnesses, obviously COVID being the most infectious of all of them. So if you're mitigating COVID, you're pretty much successful in mitigating the others. And so this is the COVID.gov website that I really like to emphasize. Simple link. It's from the federal government, and it covers the many facets related to COVID prevention and the COVID toolkit. And so that's masks, and you can get free N95 masks by clicking the link here. And then it sends you to just basically all the other kind of local resources you can access to get those free face masks. Treatment, don't forget Test to Treat still exists. It's still very pertinent for those that are at greater risk of illness. And so that is, getting those COVID antivirals are going to be helpful just to really kind of combat the virus and get it early, right? Time is of the essence. So if somebody suspects they have COVID, getting tested and then seeking the Test to Treat process ASAP so they can get the antivirals, and so it could have the most impact and reduce that severity of illness. Vaccines, obviously, in terms of prevention, so it's a great way to find, vaccine booster clinics and other sites, and it just leaks out right there. And then testing, as we've been emphasizing very much. At-home tests are a great resource, along with obviously healthcare institutions and other public sites to get tested. And so that all that can be found here, and then also ordering the free test. So if you go to this part of the website, so if you click the link I was just hovering over, you just click here, and basically it's really simple. It goes to the USPS, that's the ordering site, just because it has all the addresses and everything there. You put your name, address, and then you order it, and it's free of charge, as long as your address is eligible. And it's for free at-home tests. So definitely, carpe diem this resource, and also maintain them for any present and future use. And so again, this is from the FDA. Those the at-home, over-the-counter COVID-19 diagnostic tests, and basically what it's emphasizing here, there's been any extensions to the expiration of these items. So don't forget, they have a label on the box, but that's a static label. There have been further, approvals to extend the lifespan of these items. So don't throw them out quite yet. Double check here before you do that. And so that way, at least you have a resource, on hand for yourself, as anyone in your household or friends, that you can access as well. And so with that, I mean, just another kind of quick reminder in terms of prevention, with those face masks, as I mentioned them, there is a spectrum of protection. So keep in mind, obviously, no face mask can provide no protection. From there, you obviously have cloth face masks, and then surgical face masks, which have the 3 layers, which are obviously going to be a little bit better than the cloth face masks, and obviously not having one. But then obviously the superior choice is the N95. Followed, prior to that is obviously the KN95, but the N95 is obviously the best resource in terms of that prevention and protection, just because that is something that is, highly vetted in terms of the studies and also the consistency of the manufacturing process. And so that's something else just to keep in mind as we kind of still make it through this respiratory illness season. So again, cloth, surgical, KN95, and then N95s in terms of that better protection and of that spectrum of protection. So with that said, I think I took enough time from you guys. I just want to kind of reiterate those prevention points and kind of where we're at. So we're doing well with respiratory illness season, better compared to just even 2 weeks ago. We seem to be having a peak and demonstrated a peak with COVID, but we still can change that. That activity can still change and potentially get worse if obviously conditions are conducive towards it. So we got to be very careful and, get our way through these woods. So hopefully that things are kind of not nowhere to surprises. Obviously this has been a very unique season, especially with the triple demic component. So just want to emphasize that. But yeah, thanks again for your patience and good morning, everybody.
Thank you so much, Brian. Does any board members have any questions or comments? Great. Thank you, Brian. Really comprehensive update as always. Next item on the agenda is the Lighthouse Awards. And so all of you remember, our board members, this is the program that we've had for years. We put it on pause during the pandemic, but we're bringing it back. And Bill's going to give you, Bill Mooney, Assistant Director of Health for Environmental Health, is going to give you an overview of the Lighthouse Awards program and how we did this year.
Good morning, everyone. So the Lighthouse Awards started in 2008, and it was the Board of Health instituted to be able to recognize food establishments that have demonstrated, real good food handling practices, have had a qualified food operator or a designated alternate on site at all time, and maintained a score of 90 or above with 4 or less risk violations. So we had a little bit of a hiatus due to the pandemic. The last time we did this was in 2019, so 20 and 21. We didn't have any because we weren't really inspecting as often as we had been in the past due to the pandemic. So this year in 2022, we got back onto where we're doing more inspections. We're able to reinstitute this. And it's really important because people will look up and see how people are going to go out to dinner. They'll look up and see, what the rating is for that particular establishment. So it's good for the public. It's also great in terms of an incentive for the establishments to maintain it. So instead of just trying to fulfill their obligation to us just through the inspections, this is a really good incentive for them to maintain it because they don't like to get anything less than a 3 lighthouse. So they work really hard to maintain that. So it works both ways for everyone, for the constituents, for us, and for the establishment owners as well. This year, we had a total of 271 out of a potential 484 class 2, 3s, and 4s, which is a percentage of 56%. I asked the sanitarians to select one each for a total of 4 places that they would recommend for where we could actually provide the award to somebody and do a ceremony and bring the public awareness back to it. We haven't done it in the last couple of years. Just as another refresher, the lighthouse, we had 3, 2, and 1 lighthouses. So a 3 lighthouse was the establishment would maintain a score of 90 or above with 4 or less risk violations. Lighthouse, 2 lighthouses rather, would be where they might have a 90, but they might have in excess of 4 risk violations. And there's a total of 9 or so on the form that they could be cited for. And then if you're in the 80s, or if you have a critical violation, which is like a 4-pointer, it's really important. It could be something with food handling, temperatures, lack of water, that type of thing. It's a major critical violation, then you would get a 1. So that's the basic criteria involved with it. And again, so this year we had the 4 recommendations from the sanitarians were Notre Dame Convalescent Home, Taco Tequila, Panera Bread, and Blackstone Steakhouse. We tried to get a little bit of a variety of the types of places so that we weren't picking out on one particular group to choose from. So those are the 4 that we picked for this year for you to select, or if you have other suggestions. And if you have any questions, I'll be glad to answer them.
Just to add to what Bill is saying, in the past, the board members have, they had a recommendation and we, brought it to the mayor. Other times, you've asked us to have recommendations. And so that's why we wanted to provide you with some recommendations from the sanitarians, and then see what you're thinking, if you had any recommendations or if you want us to talk to the mayor's office. But yeah, if you have any questions for Bill or anything about the program.
I think the sanitarians, obviously, the people that are in the face to face doing this every day, they're gonna have a lot more insight. I mean, I'd be picking them because I like to go there to eat. I don't know if that's the right answer. So I mean, if looking at the grouping that you guys selected, I would pick from that grouping, and I would vote for Panera. I think that's against it. I think Terry had a comment that Blackstone might be a little bit high out of the reach of people as on a cost basis. It's an expensive restaurant, but that shouldn't rule them out. But I think that the Panera is a good cross between parts of the culture and parts of the city. So that would be mine. I think you guys have done a great job. I love the program. I love the fact we have that many hits on the website, that people are still using it, and promoting that opportunity is a great idea.
Thanks, Ken. Any other thoughts or questions?
I think that Ken sort of covered probably everybody's thoughts. All these restaurants are great. The job that you're doing is absolutely great, and I think the public really appreciates it.
Thanks, Dr. Weinberger. Yeah, there's so many wonderful places to select, and so many great places that are going to get the award this year. So really excited.
Any chance we can get covered by the North Hour, just to list everybody who gets it? I mean, it's a huge list. It's just wonderful to think that many people are putting the time and effort in to make sure they pass. I think it's just great.
Yeah. So we've already spoken to the mayor's office and their communications director, and we're going to be coordinating with them on how we get this messaging out to everybody. So we'll be sure to send a press release out. We'll do social media posts, and we'll do outreach to reporters to get them to ask them to cover this.
One other thing I forgot to mention, I just like to add also, remember it's the last 4 inspections, so it covers quite a range of time spans. So it gives an opportunity for the establishment to really show that they've been consistent for a period of time and demonstrating proper food handling practices. So that's the one part that I forgot to mention, but it's really very important.
All right, so we'll take this back. We'll talk to the mayor's office, and we'll work with our health education, health promotion team on setting up an event, and we'll work with you all with your availability so we can get something scheduled. All right, great. All right, thanks everyone, and thank you, Bill. All right, the next item on the agenda is the immunization fees. And so, again, you may recall that in the past, we worked really closely with the Board of Health to set the fees for immunization. It's been a while since we've updated them. But with the cost of vaccines increasing, the cost of providing them increasing, we want to look at the fees and update them accordingly. Darlene, can you give an update, just an overview about the travel and adult immunization program and some more additional background information?
Sure. Our travel and adult immunization program provides vaccines for travelers. It's a full array of vaccines for travelers who travel abroad, as well as adult vaccines. And we offer these at a really competitive price. Currently, the prices, the fees that we do charge are probably significantly lower than others in the community. But our travel services are starting to increase. We offer travel vaccines twice a month with Dr. Reed. And then our nurse also offers some hours on Wednesdays. So in the past, we had offered additional hours for our travel program. But throughout the pandemic, of course, there was a decreased demand. But now that it's picking up, it's important that we take a look at these fees and do what we need to do to get them, make them competitive so that we're not losing any money.
Thank you, Darlene. And I'll just add, we see this as like the first step of a more comprehensive review of the travel and adult immunization clinic, thinking in the future, part of our strategic planning, we talked about, clinical services in general. Darlene really wanting to take a comprehensive look at it, determine, what is meeting the community need, what makes the most sense for the health department, where should our focus be, what do we want to do moving forward? So we are planning on doing a more comprehensive evaluation of this program and figuring out, what do we want it to look like moving forward? Sort of a relook at, where we are today in 2023. So I want to thank Carla. She has worked really closely with Pat DiPietro, who you recall worked here for years as a business manager, and Carla is our operations manager. And so they've worked really closely on, figuring out what is the cost to provide it, what are we getting reimbursed from insurances for, what is the actual cost of the vaccine and the staffing to provide all of this, looking at, comparatively, as Darlene mentioned, where we are, what are other providers charging to come up with these proposals that we've put together for the vaccines. And just so some of the thinking behind some of this is, what's the need, like I mentioned, also the community need too, like, so for an adult vaccine, that is not necessarily a travel vaccine, but it's a standard vaccine that we want to create more access and more affordability for the community. We might charge less for that vaccine because, we know that we need to deliver that need for the community versus something where, we're getting people who's a traveler that's traveling, on vacation. And so there's sort of a difference there when we're looking at this. Does that make sense?
Yep, that's exactly how we approached it. Because we do get folks that come through, clients that come through who are uninsured and don't have, can you hear me, Dr. Weinberger? Okay. And don't have the means, but they really need it. And those individuals typically are those that are attending NCC. They'll come through for the adult vaccines and they just can't afford it. So we keep that in mind we kept that in mind when we were looking at the increases.
It's a basic formula that we use for the actual cost piece of that, correct? Has that been updated as we've been going along?
Yeah, Carla, can you talk a little bit about the formula behind the how we come together with the actual cost?
Absolutely. Good morning, everyone. So within that cost, we have put in everything. We've included all of our supplies along with the time it takes for each employee to be with that specific with that patient for that specific appointment. So everything is included. We've updated everyone's salary, when it comes down to fringe, we've updated all of this cost of the supplies. Everything has been up to date, as well as the cost of the vaccine, because as we know, the cost of vaccines go up yearly. So all that has been taken into consideration.
Are there any additional questions?
The only question I pose this to the group is try to have a better understanding. Me looking at this, I don't have an understanding of what's driving this program. Is it, 5 entries on this list that are driving 90% of the business? And we should be paying attention to at least where's the volume coming from, because there may be some obscure things that we're doing here that don't make any sense to do it, because they have to do it on a one-off basis. You'd have to bring somebody in. I mean, it's difficult to do from a cost accounting point of view when your volumes are variable. If a whole bunch of volume, the value gets more credible. But I just wondered if there is a way of getting an understanding of the volume, maybe not to slow the process down of moving forward with an approval here. But include that in any program going forward on how do we look at the actual cost based on the utilization of the program. So just a few more data points to put in.
That is great, and I would really strive to include that in the second part to this when we're talking about taking the comprehensive look. So I'm taking notes on that, and I'm gonna go back and watch the recording so we make sure that we include that. Thank you, Ken, for that. Darlene, I don't know if there's anything you want to share, just in general about the program and what you're seeing in terms of volume for the different vaccines.
Yeah, the highest seller or the most requested vaccines include hepatitis A and typhoid. Those are our 2 biggest sellers. Of course, during the flu season, flu is, we have a lot of flu that we're moving. And then Adacel or Tdap, that's the other one. That's another one that gets often requested. Those are the top 3. Japanese encephalitis, depending on the area of travel, when we start to see a lot of folks going to Southeast Asia, that's when you start to see a lot of Japanese encephalitis. But the 2 top sellers are typhoid, fever, and Hep A.
And DTaP, you market that to the grandparents, right?
That's usually through our state supplied vaccine, but we also have some when travelers are going and they need their 10-year booster. They don't get that.
But yeah, we definitely market that to the grandparents too. Yeah,
Oh, yeah.
it's important, yes.
So some of the vaccine you get actually is through the state and other is purchased. That'd be good to know if that's another, and another piece of information on each one of those, which ones are always gonna be able to provide a cost base. And other ones will be the state doesn't reimburse us enough, so we end up subsidizing that one.
Right. We do bill for if we're able to bill for it, but we bill for the administration on the state supplied vaccines, but.
What do they provide us? How much?
Only like 20, we can only.
$20, $25.
Yeah, only ones in town. We do have a couple of new vaccines on this list that we wanted you to consider. It's the HPV Gardasil. That's one. That typically we offer that through our state supply of vaccine, but there are occasions when we get requests for that vaccine from folks who aren't eligible for the state supply vaccine. And then the other is the PCV20, which is a new vaccine, a new pneumococcal vaccine. Those are the 2 newer vaccines on this list that we haven't given in the past.
Thank you, Darlene. Any other discussion? So can I ask for a motion to adopt the new fee schedule and the new immunizations?
So moved.
And moves, do I have a second?
One second.
So what, I think Dr. Weinberger got there first. Any discussion? All those in favor, say aye.
Aye.
Any opposed? Abstentions? The pass unanimously. Great, thank you so much. All right, and the last item on the agenda is public participation. Aniela, do we have anybody from the public who would like to speak? If you'd like to speak, please raise your hand virtually. Don't think we have anybody here actually attending from the public on Zoom. So, yeah, I don't see anybody. All right, so is there any other questions or discussion before we wrap up today? All right, well, thank you, everyone. It's 8:41. We will adjourn.
Good to see y'all.
Bye, thank you.
Stay safe,
Bye, everyone.